everyone. Welcome to this series of diet and lifestyle interventions for brain health. And today we have Dr. Aarti Midha sir. Welcome, sir, for this lovely session. I'm super excited to share my learnings for all of you. I'm super excited to have Dr. Dua sir, to, and I really want to learn from his learnings. And at the same time, I really want to have your thoughts about toxins and health relationship. So, in today's presentation, we are going to share how plastics impair our hormones and how this is related with the brain health. I'll take this initially in 5 to 10 minutes. Then I'll request Dr. Dua sir to discuss about these microplastics and how these are affecting our health and how we can avoid this. Thank you, Dr. Dua sir, for coming here, for joining us again. And we'll try our best to make this experience meaningful for all of us.
Thank you very much, Dr. Aarti, for inviting me and to have valuable information that I will get and the audience will get from you. So,
Thank you.
whatever I have, I will share my experience with the plastics and how we can avoid something out of that.
And how can we achieve low toxin living in
Yeah,
our
yeah,
life?
we can only achieve low toxin level if we see the content that we are using. It's almost unavoidable that we can have a totally plastic free or toxin free life. This has
Definitely.
just become a part and parcel of our life.
Definitely, sir, definitely. Let me share my screen about hormones and brain health. Just a minute. Something is wrong here. Yes, now it is fine. So, the most important thing which I want to share is for our productivity, brain needs balanced hormones. If hormones are balanced, we are productive. And we all know that aging is a natural process. पर अगर ये एजिंग नेचुरल नहीं रहती, स्ट्रेस, लैक ऑफ एक्सरसाइज, प्रोसेस फूड डाइट्स, टॉक्सिन्स, पुअर गट हेल्थ, किसी भी रीजन से अगर हॉर्मोन्स अर्ली एज में इम्पेयर होना शुरू कर देते हैं, तो क्या अगर हार्मोनल इम्बैलेंस अर्ली एजेस पे जो नेचुरल एजिंग का पार्ट नहीं है, तो क्या हमारी प्रोडक्टिविटी नॉर्मल रहेगी? प्रोबेबली नॉट. वी नीड a younger body for a younger brain. So अगर वो एजिंग है, नेचुरल है, इट्स फाइन. बट अगर चाइल्डहुड पॉपुलेशन, अडोलेसेंट पॉपुलेशन ओबीस हो रही है और वही हार्मोनल इश्यूज आ रहे हैं बिकॉज ऑफ एनी रीजन, our brain health will compromise. That is sure. So now the question is, I would like to ask from all of you, do we need diet and lifestyle approach to increase our productivity? Do we need to have low toxin living for our brain productivity also, because this head is also part of our body, and there is evidence based data that these chemicals, they are harming our hormonal health. और अगर hormonal health इस कारण से गड़बड़ हो रही है, तो क्या सिर्फ स्ट्रेस मैनेजमेंट स्ट्रेस में रिलीफ दे पाएगा? नो, इट विल नॉट. सो डेफिनेटली जहाँ एविडेंस बेस्ड डेटा है और एक रिलेशनशिप है कि जो ये केमिकल कंपाउंड्स हैं हमारे एंडोक्राइन डिसरप्टर्स हैं. एंडोक्राइन डिसरप्टर्स मायना हमारे हॉर्मोन्स को या तो हमारे रिसेप्टर्स को वहाँ जाके वहाँ फंक्शनिंग को इंटरप्ट कर रहे हैं, वट एवर द वे, बट इट इज इम्बैलेंसिंग आवर हार्मोनल रिसेप्टर्स और हॉर्मोन्स. और अगर ये हार्मोनल इम्बैलेंस रहता है, हमारी प्रोडक्टिविटी इम्पेयर होगी. देन वी आर ब्लेमिंग आवरसेल्व्स कि दिस इज अ साइकोलॉजिकल प्रॉब्लम ओनली. इट्स नॉट ओनली द साइकोलॉजिकल, दिस इज समहाउ रिलेटेड विद आवर diet and lifestyle approaches. So this is how these microplastics, these are hormonal disruptors and they disrupt our health as well as physical health as well as brain health. Now I would like to request Dr. Dua sir, how can we achieve low toxin living? How can we avoid these plastics? And what exactly are these microplastic? Please share some insights on this.
Thank you, Dr. Aarti, for giving me this opportunity to speak something about the toxins associated with the plastics. So, as we know that from the fertilization till the elderly age, we are being exposed to the lot many toxins. If pregnant mother is there, that she is already having lot of toxin in her blood, and all those toxins will be going directly into the fetus and ultimately into the young generation. So without consuming anything, that infant, that newborn is there, that contains lot of toxins which are already present in the atmosphere. So if we go through the life cycle of the plastic, so throughout the whole cycle of the plastic, from the extraction of the raw material as a fossil elements, and then the creation of plastic in the factories, then disposal of the plastic, and then the plastics going into the marine life. So everywhere these plastics are going and causing problem for the human beings. Even if we go through that some kind of biodegradable plastics, so these biodegradable plastic, though these can degrade in a, you can say, far quicker than the ordinary plastic, but these also contain the same kind of chemical and same kind of toxins. So we cannot say that these plastics are better than the normal plastics. So second thing is that recycling of the plastics. So this recycling of plastic is dangerous because these plastics contain lot of chemicals. At least studies have shown that these plastic contain at least 1,000 chemicals which are toxic to human body. So when these toxins are going into the body through inhalation route, through topical route, or any other into drinking water or food, so ultimately what they do, so at any stage these plastics are causing disruption in the hormone
Mhm.
production, hormone functioning, and ultimately because of these, you must have seen that rate of hypertension, diabetes, reproductive problems, and many other malignancies, these are continuously increasing day by day. So we cannot say that all these are because of change in the lifestyle. So many studies have gone into this, and they have already created some committees and organizations to ban such kind of toxins. So these are so much into our life. If I show my PPT, you can, Dr. Aarti, please, can you?
Just a minute.
So can I? No, I cannot. Now, is it visible?
Yes, 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 it is visible.
So here they over 1,000 manufactured chemicals used today are in the, these are endocrine disrupting chemicals. And
Mhm.
this report was published by International Pollution Elimination Network, IPEN, and Endocrine Society. So you can see that whatever the lucrative thing that we are having for the plastics, these are beautiful, colored, lightweight, fire retardant, whatever it may be. So can you see that if fire retardant, they contains chemicals, dioxins, when we burn these plastic, UV stabilizers, microwave free. So all these, and these lead and cadmium are the two heavy metals which are present, and perfluorinated chemicals are used in water, food contact papers, lubricants, carpet, paint, cookware. So there is nothing, and these plastic containing EDC, endocrine disrupting chemicals, you can see used in construction, food production, packaging, cookware, children's toys, furniture, electronics, textile, home, automobiles, cosmetics, and other common items. So now, after looking on all these, can you imagine a life without plastics? No, we cannot. But still, we can have something that we can reduce the level of toxin that we are consuming on a daily basis. So how we can do that? So one thing I want to say that these are just not plastics, otherwise also many eatables that we are using. So as one saying is that all that glitters is not gold. So all that is colorful is not healthy for our body.
Absolutely, absolutely.
Excluding the fruits and vegetables, in that way we have to have rainbow type of diet that includes all kind of fruits, vegetables, and all plant products. But in case of plastics and in case of eatables, that these whatever these, so even if we have to use the plastic, that should be, you can say, without any color, transparent plastics.
No, shift
First
to
thing is,
glass containers, shift to stainless steel.
no, I am coming to that.
Huh, exactly.
Because that one thing, that plastic is so cheap that even if you want to replace the plastic, everybody cannot replace. So two things I want to add here. First is that many people who are manufacturing the plastic, even they don't know that they are adding the toxins. So these things should have whatever the content they are adding, these content should have a clear cut warning that these are toxic to these and these are the alternatives. So all labels should have alternatives. These alternatives, usually we find that these alternatives are costly. So regarding the packaging material, bottles, and you can say lunch boxes, we can avoid these plastics. Instead, we can use, for storing the liquids, we can use glass bottles or the steel bottles. Even earthenware bottles or copper bottles are available, which are good for health. Similarly, in case of you cannot avoid these plastic, because the water that are coming into our homes, that are running through the plastic pipes, all those old metal pipes has been replaced with the plastics, and there is no control over that plastic, what kind of plastic is that, whether it is good for health or not. So that we cannot change. And second thing is that we should always avoid storing the content that we have to heat and reheat in the microwave. For that we have to use either the glass that vessels, or you can say the ceramics. These are good for health, though we cannot use the steel. So instead of using the Teflon coated that we are very fond of, that these are non-sticks. From my personal experience, if we have wrought iron and we properly, you can say, prepare that wrought iron utensil, so they work just like your non-stick. Only thing is that you have to do a proper preparation and you have to clean that in a proper way, so that we can avoid all these plastic coating over the Teflon. Ultimately, you must have observed that after a year you find that that coating has, at many places, that coating is lost. So where that coating has gone, that has gone into our body. So by
Absolutely.
using wrought iron or steel things, we can avoid these plastics going into our body. So there should be some restriction that when the lady is pregnant, so we should have more restriction on the diet and the things that she is consuming, and the utensils in which the food is being prepared. I strongly condemn that we should not use that aluminium, that I have already replaced everything that was of aluminium, mainly cooker that we commonly use. So
Yeah,
that steel cookers are available. These are good for health also. You cannot, and the aluminium, ultimately we find that all those margins are got smooth. So ultimately, whatever the utensil we are using, and ultimately something is going into our body, and this aluminium is also neurotoxic and have caused many
absolutely,
problems.
absolutely, absolutely.
So this way, one thing more. So whatever that, you can say, we cakes we are using, confectionery we are using, we are very fond of that, ordering the cake that contains the cricket field, that contains some kind of other bat ball or some toys or cartoon characters. So
Uh-huh.
these are all colorful. And who are the consumer? These are kids are the consumer of that, all those things. So
Uh-huh.
ultimately, consciously or unconsciously, we are letting them consume that. I
Uh-huh.
always prefer that the cake I am bringing to my house is totally colorless, though mild color is there or it should be white
Follows the
cream.
food colors create.
So,
Yes.
yeah. So, similarly, sugar candies are there and many other things that we consume. So,
Absolutely.
that is, and Indian kitchens are the best medical store also, provided we
Kitchen
gather
is your
some
pharmacy.
information. Huh?
Yes. Kitchen is your
Fa-
pharmacy.
yeah, kitchen is your pharmacy. So that
Absolutely right.
pharmacy, we are forgetting that pharmacy, and every time something happens, go to the clinic, go to the clinic.
Uh-huh.
And for doctors, for their any ill, there is a pill. And
Uh-huh.
for pill created ill, there is another pill.
Absolutely.
Pill
Absolutely.
over pill. We take antibiotics, we develop diarrhea. For that, we have to give something. We develop acidity, we have to give something. So that only if we are conscious enough to have some information, we have to read information and we have to apply those information to have some low toxin diet and low toxic atmosphere.
Here I would
Even
like
in
to
the
add,
rooms also we have so lot of furniture, these formaldehyde and many chemicals which are leaching into our atmosphere, into our food. So that we should avoid. So by using all these simple measures we can reduce the level of toxin, but we cannot have totally toxin free life,
yeah,
if we
but
say.
why this low toxin living is required? At times when I talk to my patients about low toxin living, what they say first, what exactly is the relation with the brain health? Then I tell them this is how they disrupt your hormones.
Yeah, yeah,
Now the other thing that, which is very important, at times the patients have their genetic histories कि
yeah, yeah.
मदर को प्रॉब्लम था फादर को प्रॉब्लम था व्हाट अबाउट फॉर माय किड्स मेरे बच्चों का क्या होगा then I my intention is to share this topic that is if we are changing our environment if we are changing our environment we'll change the atmosphere around our genes we'll be able to suppress our genes.
So Dr. Aarti, this is very good, that insight that you have given, that though we claim that our genes are responsible for many problems,
This is
but
environment.
it has already been proved that we can suppress and we
Environment.
can enhance the functioning of the genes just by changing our environment, our thinking.
Intention of taking this diet
Yeah,
and
yeah,
lifestyle
yeah, yeah,
intervention series was that what should I do to suppress my genetics and what can we do for our kids where people are asking we have these genetics what will happen further we can change our own environment also and for our close
so
dear and
these toxins may be playing some synergistic effect on those defective genes and we can avoid that synergistic effect.
so for every disease, we know that there is genetics that are responsible. The stress is responsible. Your diet and lifestyle is responsible. Toxin is
Yeah,
responsible.
yeah,
If you start working on every perspective, this is the holistic approach by
yeah,
which
yeah,
we help people and help
yeah, yeah.
ourselves also, so that we can change our bad genes, not change, sorry, suppress those genes, and we can change the environment surrounding them.
Yeah, so sometimes I think that we have progressed from those times that when for tubercular patients sanatorium were there. So ultimately those I if I think that those sanatorium still these have value at present time, because those big halls containing total cross ventilation and sunlight, and these are the two contents which are essential for good health also. It's not for the tubercular patient, but it is also for the normal human beings also.
For
We have enclosed ourselves in enclosed containers or rooms with air conditioning and lot of furniture and lot of plastic material. So all these things, and rooms are closed. Even if with all those things, if our rooms are properly ventilated, we can avoid the level of toxins going into our body.
Solution to the pollution is dilution.
Yeah, yeah. Solution to the pollution is dilution. That's great.
So thank you very much, Dr. Dua sir, for joining us